Hello, my name's Ray Wells. I'm a Medicare guide here in Knoxville, Tennessee. I'm going to talk this morning about Medicare, specifically Medicare Part A. And what I'll use to describe this coverage, which is hospital insurance, is the government's book, which they put out called Medicare and You. This is this year's edition, 2016. There'll be a new book coming out this fall for beginning January 2017 coverage. Now, Part A, it says on the card, it's for hospital. I'll note that Part A in their booklet, it takes up just 4 pages, so it's a fairly brief coverage in terms of what the book talks about. Let's get into a little bit more details. It asks, what does Part A cover? It says Part A, hospital insurance, helps to cover. You've probably heard that Medicare does not pay for everything, so it does help inpatient care in the hospital. And on page 40 of the booklet, they emphasize, they say it's important to note, am I an inpatient or an outpatient? It says if you're in a hospital, you or a family member should always ask if you're an inpatient or an outpatient each day during your stay, since it affects what you will pay and can affect whether you'll qualify for Part A coverage in a skilled nursing facility, which is the next thing they talk about. Part A covers inpatient care in a skilled nursing facility. They emphasize it's not custodial care in the home, and it's not long-term care in the home or an assisted living center or nursing home. Part A also covers hospice care, and it does cover home health care, where you have a licensed medical professional like a registered nurse coming into the home and doing something like wound care. Now, sometimes they say the devil's in the details, and a little bit more on Part A in terms of what it might be out of your pocket. First of all, Part A has a deductible for days 1 through 60. The deductible is $1,288. And unlike a plan you may be on now that you own individually or perhaps an employer plan, this is not an annual deductible. This is per confinement. Now, once you've met the deductible, if you're still in the hospital on day 61, you also have a $322 a day copayment. So if you were in for days 61 through 90, that would be $9,660 in addition to the deductible. Not many people are in the hospital on day 91, but it does happen. On day 91 through 150, those 60 days have a $644 a day copayment, which if you were in for all 60 of those days is another $38,640. Now I said that Part A covers skilled nursing care. The fine print says that you need to be hospitalized for at least 3 days and enter a Medicare approved skilled nursing facility. When you do, then all your eligible expenses are covered for the first 20 days. If you're still there on day 21, days 21 through 100, this year there is a $161 a day copayment, and that would be another $12,880 for days 21 through 100. Now, on day 101, if you are still in that skilled nursing facility, it's important to note that Medicare does not pay anything. So that in a nutshell is how Part A works. My name is Ray Wells, Medicare Guide here in Knoxville. My phone number is 865-300-1850. Thank you.